Now, it's true that COVID-19 cases have increased nationally and in Ohio in recent weeks as a result of Omicron and its subvariants. But as always, it's important to put the numbers into context. The virus is still out there, circulating for sure. But Ohio's case totals remain a fraction of what they were in January. Now, we recognize that some of this is because fewer people are now getting tested, or they're not reporting their test results. That is certainly a factor. But even taking that into account, it's clear from looking at the numbers that we're still doing well when it comes to the volume of severe disease we're dealing with. The number of people hospitalized with COVID-19 in Ohio is currently 582. And that compares with a peak of over 6,700 on January 11th, according to the Ohio Hospital Association data. Now, based on my verbal communications with colleagues, it also appears that many of those admissions are for other reasons among patients who also happen to have COVID. And the weekly average for deaths in Ohio has declined 16% over the past 3 weeks. What this tells us is that immunity, especially from vaccines, is making a difference. About 2/3 of eligible Ohioans now have at least started their vaccine series, and more than 60% have had 2 doses. While, of course, we want to see more eligible Ohioans fully benefiting from vaccination, this and some level of post-infection immunity among those who've contracted COVID-19 have combined to create a substantial level of protection against severe illness. This underscores the wisdom of the Centers for Disease Control and Prevention adopting its COVID-19 Community Levels Index, which takes into account more than just case counts, but also hospitalizations and percentages of hospital beds occupied by COVID-19 patients in each community. On the latest CDC Community Levels map, all but one of Ohio's 88 counties is green, signaling a low level. Lawrence County is yellow or medium. Nationally, more than 81% of counties are green and only 4% are orange or high. This is good news as we head into warmer weather, but we need to take this opportunity to prepare for the fall when more of us are indoors, or to prepare for unanticipated changes in viral activity. We need to be asking ourselves right now, how can we fully prepare for the future to protect ourselves from severe illness? Now, the best and safest way to prepare our immune system remains vaccination, especially keeping your vaccination fully up to date. Now, for most people, that means a 3-dose series. Some may need additional doses, which we'll talk about with our guest a little bit later. And when you look at the cases that are requiring hospitalization for the treatment of COVID-19, they're primarily people at the greatest risk for severe disease, those of advancing age or who have serious underlying medical conditions impacting their immune systems. For that population, we have another important option, and that's therapeutic treatments. We're fortunate to have some very effective therapeutic treatments right now. In general, these treatments are designed to help people who have become infected fight the virus off, and especially to help high-risk people who get infected to avoid severe disease. Now, these therapies, like so many medications, can interact with other prescribed medications or affect or be affected by changes in vital organ function, like those of the liver or kidneys. As a result, determining whether an available treatment might be right for you really requires a medical provider to assess your individual circumstances and situation. Your medical provider has the training needed to help make the right decision, regarding whether a COVID-19 therapy would be appropriate for you, and if so, which one. Now, in order to help with this process, the Ohio Department of Health continues to expand our network of sites able to provide these treatments, and also continues educating and informing both medical providers and the public about the benefits and availability of therapeutics. Now, on the first point, we feel the state has a strong infrastructure of sites able to provide these agents. These include hospitals, federally qualified health centers, retail pharmacies, and long-term care pharmacies in 87 of our 88 counties. We'll continue efforts to grow this network, and we're currently registering more urgent care centers. Also, to support our medical providers, we held a webinar earlier this week in which medical experts helped give providers across the state the information they need to better understand therapeutic options and current best thinking about the medical decision-making surrounding those. Secondly, we now have on our website an easy way for people to access information regarding where to go to get tested or be evaluated for potential therapeutic treatment. The way to access this is to go to the new COVID-19 testing and treatment page at coronavirus.ohio.gov. Among the resources there are state maps showing the locations which have therapeutic treatments available. That includes a map of one-stop sites called Test to Treat locations, where patients can get tested, get a medical evaluation, and if appropriate, receive treatment. Now, in thinking about these therapies, I think it will be useful if I briefly summarize the major therapeutic options that we currently have at our disposal. First are monoclonal antibodies, and for the most part, we're currently working with two, bebtelovimab and Evusheld. These are medically manufactured antibodies given to help our immune system in its effort to fight off viruses. Now, bebtelovimab is currently the only monoclonal effective against the BA.2 subvariant of Omicron, which is what we're seeing the most of here in Ohio. Bebtelovimab is administered through a single IV infusion that lasts approximately 30 seconds, and it should only be administered within 10 days of symptom onset. Evusheld, on the other hand, is a protective antibody, meaning it's intended to prevent disease among vulnerable people with severely compromised immune systems before they're ever exposed to COVID-19. Evusheld is given as an injection into the muscle, and it may provide protection for up to 6 months. Then there are antiviral medications, which work to keep the virus from replicating properly, and as a result, give your immune system an upper hand in fighting the virus. Now, currently, the most important of these is Paxlovid, and it comes in pill form. The treatment course of Paxlovid, though, has to be initiated within 5 days of symptom onset. This makes it imperative that people who want to get treatment get tested as soon as they think they may be infected. And then, of course, to work with a medical provider as quickly as possible if they test positive. Now, we want everyone to understand that especially for people in vulnerable and high-risk categories who are more likely to get sick despite vaccination or past infection, therapeutics are a vital tool in our battle against COVID-19 because they may prevent an initially mild COVID illness from getting more severe and landing you in the hospital. Now, it's important to note that therapeutics are not for everyone, and they certainly shouldn't be seen as an alternative to vaccination. Getting the vaccine and appropriate follow-up shots really should remain the foundation of protection against severe illness from COVID. And remember, your provider remains your best guide to your health. The Ohio Department of Health will continue to work with providers to communicate and help them feel comfortable prescribing therapeutics, even as the virus and available options for treatment continue to evolve.